Hi, my name is Mika, and I am a doula with the Oakland Better Birth Foundation and Schiffer Circle. And I'm here today with my sister doula, Kathleen, and we're going to demonstrate a few techniques that can support you in labor, particularly with back labor. And the first technique is counter pressure on your sacrum. And this can be really helpful, again, when you're feeling those contractions in your lower back. And it's best if the person is leaning over, so either leaning over on the birth ball is really nice because that also just takes pressure off your sacrum and your lower back, or leaning over onto something. Is it okay if I touch you, Kathleen?
Yes.
So the first thing you're going to want to do is find your partner's sacrum, and you're going to want to use the heel of your hand here. So I just kind of start by pressing down lightly, and I ask how that feels. How does that feel?
That's good.
Good. Do I need to move higher or lower?
Maybe a little lower.
Okay. And then I press down, but I don't use my arm strength. I actually use my body, because that helps me sustain this position for a longer period of time without tiring out my arm. And you would stay here for the duration of a contraction. You are not pulsating, you're not massaging, you're just applying pressure. And then when the contraction's over, then you can stop, maybe just put a light hand there, but you don't need to put that same pressure. And then you would go back. And sometimes the place where it feels good changes as the baby gets lower, and so you can ask again, how does that feel? And check in. The next technique is counter pressure, or is double hip squeeze, another form of counter pressure.
Mm-hmm.
And a lot of people really like this in labor. This is a very popular one. And what you want to do is, you're going to use that heel of your hand, and you want to find the squishy part of your hips where it kind of dips in, of your partner's hips. And you can find that by looking, if your partner has jeans on, you could look at or think about where the outside of those jean pockets are. You can also put your hands at the top of their hips, and where your palms land is oftentimes where that dip is in the hips. Then, so if your hands are like this, you would turn them to the side, and your elbow is going to be out. This is going to protect you and your back and your arms. And then you're going to squeeze in. Like that. How does that feel?
That feels good.
Good. I'm always checking in with Kathleen to see how she's feeling. Similar with the other form of counter pressure I just showed you, with this one you're going to hold it for the duration of a contraction, and when that contraction is over, then you'll release. For your own body, it's ideal to have like one leg between one of your partner's legs, or your legs between your partner's legs, arms out, back as much as possible, kind of straight, to protect you and your back and your arms. And those are two wonderful forms of counter pressure that you can use during labor.